Good evening. My name is Dr. Stuart Dichek. I'm a board-certified pediatrician. I am on the faculty of New York University School of Medicine, an attending physician at Langone Medical Center in New York City. As many of you know, I'm a community pediatrician here in the Midwood section of Flatbush. I've been heading up a number of efforts in recent weeks to try to prepare the community for the coronavirus outbreak, including a critical meeting that went on this past Wednesday night with community leaders of yeshivas or parochial schools, and other activists in the community who are trying to get the message through some experts that I've been joined on a task force with. Dr. Carter Meacher, Dr. Jay Schnitzer, and Dr. James Lawler are all experts on pandemic outbreak and contributed to the program that we put together this past Wednesday night for the Jewish community. The message at that program was to present all of the data on the current coronavirus outbreak, which, as all of you know, is quite serious. There were 4 points that we brought forward in an effort to bring down the severity or the rapidity of the infection right now, in order to give the medical systems a chance to activate and to work properly, specifically for individuals who are at risk, who are going to need respiratory support, such as ventilators, to get the care that they need in countries where these efforts were not implemented. Obviously, the curve that Dr. Fauci so effectively speaks of, or the rapid nature of the onset of the epidemic, has caused many people to die waiting for treatment, specifically when related to critical care or related to ventilatory support or support for them to breathe. So we proposed 4 simple steps that need to be taken immediately by the community. Step number 1, if you are sick, obviously stay home. That is called home isolation. Step number 2, if someone you know or if a member of your household is sick, obviously stay home and quarantine until the 14-day period passes where you're confident that you're no longer contagious. We recommended on that evening that all schools and daycare centers close immediately as a way to decrease community spread within the Jewish community. Step number 4, critical, is social distancing in the community and in the workplace. For those who can work, they should work through telecommuting. For those who have to go to work, obviously they need to take great caution in using proper hygiene and care in order to do that. Now, I want to be very blunt. At the meeting, there were a large number of schools, principals, and community leaders. About half of those present in the room immediately within 48 hours closed down all of their schools in an effort to stem the degree of infection. The reason for closing down schools, so people understand, is very clear. Children, thank God, are at very low risk for getting very sick from coronavirus infections. There have absolutely been no deaths reported in children under 9 years of age throughout the world who have gotten coronavirus. However, children are very healthy vectors of infection that can actually get mildly sick or moderately sick and pass on the infection to those who are high risk, such as the elderly or individuals with chronic medical conditions. So closing schools was a proposal that would save lives in the long run by trying to ensure that the number of infected is spread out over a long period of time rather than a short period of time where a large number of people would become infected quickly. The medical systems or the healthcare systems would quickly get overwhelmed. And unfortunately, we were trying to avoid seeing a situation like occurred in Italy or is occurring in Italy, where people are actually dying during triage and ventilators are in such short supply that people who need them are not getting them if they are selected out as not being viable enough to save. So the recommendations went on deaf ears for part of the group, and part of the group closed their schools. I took issue with schools remaining open. One of the situations that I had to contend with, and it was told to me by many of the Orthodox yeshivas, is that they're following Mayor de Blasio's lead in keeping the public schools open. I explained to the community that Mayor de Blasio has different priorities than we as a community do. Specifically, his Chancellor, Richard Carranza, said on Friday in a major interview, a major statement, that much of the reason for keeping public schools open was to make sure that Children from lower income families receive hot meals every day and, in fact, get their clothes laundered. I didn't know that that was part of the public school system. And Mayor de Blasio added to that if we close public schools, that it will affect the economy in New York in ways that he would consider to be aggressive and undesirable. Clearly, we as a community don't share those concerns, and I think Mayor de Blasio is making a colossal error by keeping the public schools open. At this point, it's quite obvious to everybody that we are in a state of emergency and schools should be closed immediately. It is imperative that the schools close immediately. Mayor de Blasio has made a terrible choice, and quite frankly, I am shocked at it. And I'm shocked at my community, or the portions of my community who are following Mayor de Blasio's lead. This is not a snow day decision where you follow the mayor on his decision to close schools. This is a much more critical decision. It has to do with pandemic, and it will make a difference in the tens of thousands of people potentially who might die by keeping the schools open. Every day that we keep the schools open now, more and more children will get cross-infect between each other. They will bring it home to their parents and grandparents, and their grandparents certainly cannot afford to get this infection. Tonight, I've been notified of 3 critical situations in grandparents in my practice who are from the community who are admitted to the hospitals in New York City. 2 of them are in a fairly critical condition. 1 is moderate and stable. It is imperative right now that all schools close down, whether they be yeshiva, parochial schools, or any other schools, private schools as well. It is imperative. It has to happen immediately. It should have happened way before today. Number 2, it is extremely important in the Jewish community. Jewish community, Orthodox community, is very community-oriented. We have parties, we have get-togethers, we go to synagogue 3 times a day. We get together in large numbers on weekends in the synagogue for Sabbath services. This Sabbath in my neighborhood, many of the shuls were closed down. Many of them were open. Many people flaunted the recommendation not to go to synagogue this week. I actually stayed home from synagogue. I prayed at home with my family as I thought was appropriate because I didn't want to risk getting infected or infecting anybody else in the event that I am getting sick. I want to read to you recommendations from the brave and absolutely appropriate recommendations made by the Vada Rabbanim, or the Rabbinical Council of Bergen County, several days ago. Bergen County is in northern New Jersey, a very educated community, Orthodox Jewish community as well. And there was a meeting between the community leaders, the rabbis, and the local government and the 3 hospitals in the area, Englewood Hospital, Hackensack Medical Center, and Holy Name Hospital. The hospitals pleaded apparently with the community leaders that if the epidemic hits northern Jersey early, that their 3 hospitals will quickly be overwhelmed and that they will be unable to serve the community with the number of ventilators they need and the number of ICU beds they need. They implemented an immediate proposal which was adopted by the group, and I'm going to read the proposals. The proposals were all community members were encouraged to work from home if possible and stay home whenever possible. Number 2, as the schools are currently closed, there should be no play dates between children of different families. This would undermine the entire purpose of school closings. Number 3, shuls or synagogues will be closed for all prayers and lectures effective Friday morning, March 13th. There should be no places of worship within the home. As groups, people should pray individually. All of the rabbis will be praying alone in their homes as well. Please pray at your home individually. That's what I did this Sabbath, and so did many of my colleagues and friends. There should be no public celebrations at this point. There should be no public gatherings for celebrations such as engagement parties, vorts, l'chaims, circumcisions. This week, a very close friend of mine had a first grandson. They were planning a Shalom Zachar, a party for a firstborn, for a baby boy on Friday night in their shul. They canceled it. I was very proud that they did that. Many people were grateful to them. Next Friday, God willing, they're going to be making a circumcision in their home with only a minyan, or a quorum of 10 men and several immediate family members. That is it, 12 to 15 people for the circumcision. People should not get together for Sabbath meals at this point other than immediate family. Shiva visits, when somebody passes away, should be replaced by phone or video calls to pay honor or respect to the families that are sitting Shiva. Funerals should be restricted to small groups of family members for a total of a minyan, or 10 people, 10 men, or a quorum. Refrain from contact sports where we can exchange secretions or droplets. Restaurants should not seat customers, although people can go pick up foods for order or have them delivered to their home. The mikveh or the ritual baths will remain open under the guidance of CDC and local health authorities. Women under mandatory quarantine or who are experiencing symptoms of illness may not use the mikveh, and they advise consulting the rabbi to see whether appropriate or not. So these were the 10 recommendations laid out by the Vada Rabbanim, the Rabbinical Council of Bergen County. It is critical that the entire Jewish world, whether it be New York, California, Texas, Florida, Chicago, no matter where, Cleveland, we adopt these regulations immediately. All synagogues should be closed, in my opinion, in my medical opinion, immediately. There should be no gatherings in synagogues right now. This is a pandemic of the likes we have never seen, unless those of us who were born 1918, to my knowledge. I don't have any individuals that I know of who were around then who can explain to us the nature of what that Spanish flu pandemic was like for the communities. We can save hundreds of thousands of lives if we implement the 4 steps that I spoke of, developed by the task force that I laid out, or by implementing in the communities the 10 steps that I just spoke of that have been laid out in northern New Jersey and Bergen County. I am imploring everybody to make sure all yeshivas are closed. I'm told that tomorrow morning, Sunday morning, many of the yeshivas in Brooklyn will still be open. It is inappropriate. It is completely inappropriate to keep children in school at this point. I beg of you to not send your children to school. Please pressure the rabbis or the individuals, the board members who are responsible for keeping these schools open right now, and let them know that they are acting very irresponsibly. Lives will be lost if we continue to feed this infection by allowing children to get exposed and re-exposed in school. It should not happen. Rabbis should have immediate emergency conferences, preferably by phone, and get together and get the word out to communities that until further notice, all of the community meetings such as synagogue, davening, or prayer services should be held at home, individually and privately. This is not a new concept. It's discussed in the Gemara. The Gemara speaks about times of epidemic and specifically states that during times of epidemic, people need to stay at home. Right now, we're advising that if you're not infected, you can go out shopping, you can pick up food, you can pick up medicine, you can check on the elderly and make sure they're okay, shop for them, pick up their medications, bring them food. If you are infected, you need to stay at home. If you think you are infected, you need to stay at home. There are far more cases out in the community than we are able to tell you because, quite frankly, we have no ability to test right now. The only tests that are available are those that are being done in the emergency room primarily. And the emergency room, if you're not sick with respiratory problems, with respiratory difficulty, you should not be in the emergency room right now, because if you didn't have coronavirus, when you got there, you might get it before you leave. So only individuals with respiratory distress should be going to the emergency room to get tested, or respiratory difficulty. If you're healthy and you're suffering through this virus, in other words, aches, pains, headaches, sore throat, fever, cough, stay at home, quarantine yourself, drink plenty of fluids, take fever-reducing medication, and make sure you stay at home because your period of infectivity may be for a very long time. It is best to act in this manner. I am not directing people to act without rabbinical guidance. I think it's important that they go and speak to the leaders in the rabbinical world to make sure that synagogues are closed as well as yeshivas at this point. The period of closure can only be determined once we see how the curve behaves that controls how quickly this infection is spreading through our communities. If we slow down this infection rate, we can save lives by giving the hospitals a chance to operate efficiently, have enough ventilators so that critically ill patients can be breathed for, can be ventilated on machines. If we continue at the current pace and we don't implement these steps, we are at risk of running out of ventilators quickly, as they did in Italy and other countries. So as a physician, as an Orthodox Jew, and as somebody who cares about his community, please take these words to heart and get the word out. Please close down all these celebrations now. close down all group gatherings. Let's behave responsibly as the great community that we are. Thank you very much.